Colorectal cancer is the third leading cause of death from cancer in the U.S. However, early colon cancer screening can greatly decrease the chance of dying from these cancers. Dr. Hanson Lee of Methodist Hospital in Arcadia, California, discusses risk factors of colon cancer and the benefits of getting a colon screening.
Colon cancer, unlike most other cancers, has something that we've known for a few years. It has this intermediate step called adenoma. Adenoma is another term for saying tissue change or precancerous polyp. We know that typically from normal to cancer takes approximately 10 years. Polyp is what we assume to be the intermediary between normal and cancer. So the idea is if we can screen it so that we identify and remove these types of polyps, then we're able to turn back the clock, so to speak. We typically think of the risk population in two groups. There's a high-risk population, then there's the average risk population. Unfortunately, there's no low risk. For high risk, we're thinking of family history of colon cancer, particularly in first-degree relatives, that's parents, siblings, and also personal history of potentially precancerous conditions, including certain types of colitis or even, say, abdominal pelvic radiation at a younger age. Now, for average risk patients, that would be the rest of us, typically above 50 years of age. According to American Cancer Society criteria, the screening does start at 50 for most people classified in the average risk category. Other risk factors may include cigarette use, which typically increases the risk of colon cancer by 20%. It may be certain types of diet, for example, a diet that's high in red meat and low in fiber, fruits and vegetables. It may even be lack of exercise. A colonoscopy is a camera-based exam. There's a camera located at the end of a long, thin, flexible scope. During the examination, the patient is made comfortable via the use of what we call conscious sedation. Essentially, an IV is started within the patient prior to the procedure. A couple of different medications are given. Essentially, patients are in what we call twilight state. They don't have recollection of the procedure, and yet they maintain all their vital reflexes. The procedure, when well prepped, takes approximately 30 minutes. During this procedure, we will insert this flexible camera from the bottom, and we will traverse to the end of the colon. A colon on average is about 5.5 feet. So we go there to the end and we come back, taking time to look for any potential significant findings, such as these polyps. When we find these polyps, we try to remove them. Sometimes there may be size cutoffs. If we were to unfortunately come upon a larger than usual polyp, we may only be able to sample, but our intent typically is to remove the entire problematic polyp. At the initial diagnosis of colon cancer, we want to stage the condition. So typically, in addition to colonoscopy, a CAT scan may be performed looking for spread outside the colon. Depending on the degree of involvement, either a surgeon, a medical oncologist, or possibly additional radiologists may be brought in.